Hello, I'm Dr. Arkanil, working as a junior resident in the Department of Palliative Medicine at Aiims, New Delhi, currently in my final year. And I passed my Mrcp Part 1 back in 2023 and passed my Mrcp Part 2 in the 2024 February that. And I followed the question banks mainly. That was the mainstay of my preparation. I did the PASTEST, and after completing the PASTEST, I did the PASSMEDICINE. And after completing both of the question banks, I took the Mrcp syndrome Dr. AHAD'S course. And what I want to tell that if you really want to ace the part 2, you have to go through all the topics which are important and which are the RCP favorite topics, and you have to go in depth, because understanding the topics and understanding and differentiating between closely related conditions, diagnosis, treatment protocols, and that's the mainstay of preparing for Mrcp part 2. Just knowing the facts, just going through the MCQs won't take you to the passing marks, because it's really tough. In case of Mrcp part 2, you just can't give it a single thought and then go and jump to the answer, because if you jump to the answer on a single thought, and it can sometimes, and most of the times, you will end up being wrong. So for that thing, you need in-depth knowledge, and you need to consolidate the RCP favorite topics. And for that, Dr. AHAD'S Pearl Notes, if you don't have time, that's the best thing you can have at your end. I took those notes, and that was something I used in the last month of my preparation. I had 3 to 4 months for the preparation only, so I completed the QBanks in the first 3 months of my preparation, and after that, in the closing stages, I went through the notes and the Pearl Notes and the MADBOX courses. And this MADBOX is something really, it's a gem. If you just consolidate and concentrate on the MADBOX, you will just cover 90% of the important topics. And just before the day of the exam, or just the preceding week, you just sit and go through the MADBOX, and you're there. You will very much confident about the exam and your preparation. And whatever I can say is that just polish whatever you know everything. Just go through them and just keep the faith and just keep confidence inside you. And you are a clinician, and at the end of the day, the judgment you make is final. You want to do in your clinical practice, and you will do on the question paper also. So it's like being a clinician, you're attending the exam, and you have to think that the exam, at the end of the day, you are just seeing 200 patients, 100 plus 100 in both the papers, and making diagnoses, prescribing some medications. So all of us, thank you.